Cardinal Virtues just did a video about a PM he received from a man named David Andrew Christenson, who sometimes refers to himself as Captain David Andrew Christenson. I have no idea if the captain is legitimate or not. Christenson believes in something called the Katrina Virus. This is apparently some disease coming out of Hurricane Katrina that the government is responsible for, or at least responsible for covering up. Now, he has a YouTube channel, and one of his videos is called 400% Increase in Suicides. The Katrina Virus is Real, and it triggers mental illness. Now, I will leave a link to this video, should you wish to watch it. And he does provide some links, one to a Lancet article. I've read the Lancet article, and I have no idea where he got his 400% number. I will, of course, link the article so you can see for yourself. He does not understand, or refuses to understand, this article. He complains that the authors of the study did not consider pollutants or chemical warfare components as possible factors for the increase in suicides. Well, according to the article, quote, evidence from European countries indicates a significant rise in suicides from the economic recession, totaling more than 1,000 excess deaths in the UK alone. Among the worst affected economies in Europe, such as Greece, suicides have risen by more than 60% since 2007. Thus far, there has been little or no analysis of U.S. mental health data, mostly owing to delays in data availability. So it's not just the U.S. or the Katrina region that's suffering an increase in suicides during the recession, it's Europe as well, at least according to the Lancet. So it would seem unlikely that pollutants or chemical warfare components would have anything to do with this. Now, also according to the Lancet, quote, a 1 percentage point rise in unemployment is associated with a 0.99% increase in the suicide rate. Rising unemployment could account for about a quarter of the excess suicides noted in the USA during this time. Further, the pattern of accelerating suicides noted in the USA mirrors that recorded for economic reasons in Italy. Future research should explore other risk factors, such as foreclosures and job and income losses, and modifying factors, access to the means of self-harm, and vulnerable groups. Unquote. Now, the conclusion in part, our findings have immediate implications for policy, given that some countries have avoided increases in suicides despite a significant economic downturns. There is a clear need to implement policy initiatives that promote the resilience of populations during the ongoing recession, unquote. So this is what this study was all about. Why, given that the recession was severe here in the U.S. and in Europe and other places as well, but these are just the places that were considered, how come some countries had a noted increase in suicides and others didn't? These are things that need to be looked into so we can, next time there's a catastrophe, we can avoid the increase in suicides and get people who are likely to be more seriously affected, get them some help. Now, Christenson also says New Orleans has the highest death, cancer, infant mortality, suicide, etc. rates in the nation. Get copies of the Harvard Medical School study on Hurricane Katrina, unquote. Now, I'm not sure if he's saying that the Harvard Medical School study indicates that New Orleans has the highest death, cancer, infant mortality rate, etc., because he's kind of unclear about a lot of things. Now, the only Harvard Medical School study I could find is the Hurricane Katrina Community Advisory Group, which is from their Department of Healthcare Policy, and information will be linked below. Now, this was a telephone survey of 1,043 adults, pre-hurricane residents of the counties in Alabama and Mississippi and parishes in Louisiana directly affected by Hurricane Katrina, and was carried out between January 19th and March 31st, 2006. Quote, the report presents overview results from the baseline survey. The topics covered include evacuation preparation, post-evacuation stress, current practical problems of survivors, rating the helpers, and a number of other things, including negative emotional reactions and positive reactions. A number of other things was otherwise it was a quote. And this was done by phone because the Katrina survivors were so widely scattered. Now, they did ask about health problems, and this may be where Christenson got his data. But I wanted to note something here, and it says that some of the people with pre-existing health problems didn't get any help after the hurricane because they may have stopped getting treatment, or their treatment may have been erratic, and this could have been for various problems, including the availability of treatment, the difficulty of, accessing their medical records, the inability to find their healthcare providers, insurance screw-ups. There are a lot of possibilities for them not getting healthcare. Now, I haven't looked at the data set, only this report. There may be another report out there, or an update to this one I couldn't find, but admittedly, I didn't do an really intensive, exhaustive search. I mostly was just trying to find something that related to what he was talking about. Now, one thing that's noteworthy in this Harvard report is a statement, quote, "It is noteworthy that indicators of post-traumatic growth were not strongly related to serious mental illness or mild-moderate mental illnesses, which mean that a great many Katrina survivors are understandably depressed, by their losses and anxious about their uncertain future," unquote. Now, this is in reference in part to suicidality. It talks about that before and after. And I mention this because it shows that the kind of stress that can lead to suicide is not restricted to those who already have a mental illness. Now, let's go back to the Lancet article for a minute. Christenson then says, "I believe the CDC gave you correct gross numbers but altered where the suicides occurred. Think about this for a minute. 8 states were decimated by the economy. Las Vegas should have a very high suicide rate," unquote. It does. Las Vegas is known as the suicide capital of the United States. Apparently, Christenson didn't bother to do any research. He's just going on his assumptions that are base up his little fantasies. Now, an article by the Las Vegas Sun, linked, of course, it points out that according to the coroner's office, there were 346 suicides in 2007, 382 in 2008 when the Great Recession was underway, 359 in 2009, and it jumped to 400 last year. Although the recession officially ended in June 2009, according to the National Bureau of Economic Research in Cambridge, Mass., one wouldn't know it by looking at Las Vegas' economy, which declined last year. One academic who has studied suicides in Las Vegas is Matt Ray, assistant sociology professor at Temple University in Philadelphia. And he said, "What we are seeing in Las Vegas in recent years is a strong statistical signal that the unprecedented 4-year decline in Las Vegas is resulting in more suicides. It may continue to do so until the unemployment and foreclosure crisis passes, or it may reach a plateau and level off," unquote. So Las Vegas didn't get off scot-free. Now, it has been mentioned in other articles about the Las Vegas suicide rate that some people come to Las Vegas in order to die, and that suicides in Las Vegas can be related to gambling losses. However, this increase in suicide comes at a time that there was a significant decrease in tourism, further indicating that the increase in suicides was linked to the downturn in the economy. Christenson is clearly a conspiracy crackpot and should be dismissed outright, but I think that it's a good idea to occasionally point out just how poor the information that such delusional folks spout actually is. Thanks for listening, watching.